Hello and welcome back to Sounds on the Couch. I am really looking forward to introducing today's guest for you. We've got Dr. Paul Paddle, who is an ENT, a head and neck surgeon with a fellowship training in laryngology, which is all about voice, airway, and swallowing disorders. He has a Bachelor of Medicine and Surgery with honours at Melbourne University, receiving the Dux of Surgery. He's also got a fellowship to the Royal and Australasian College of Surgeons with advanced training in Otolaryngology, and I know I've said that incorrectly, so he can correct me afterwards, which is head and neck surgery. So Paul has been involved with developing a vocal fitness training app, which is currently in the alpha testing stage, which we will hear more about throughout our chat. So let's just bring him up and we can start hearing all that he has to share with us. Hello, Paul.
Hi, good evening, Karen. How are you?
I'm good, thank you. Thank you so much for joining us today.
My absolute pleasure. Thanks for having me.
So let's maybe start by just sharing a little bit about your background and what it was that inspired you to start working in such a specialized field.
Thanks, Karen. So medical school, you met with all kinds of opportunities and choices. And it's as much as you like to think it's all part of some grand plan you've schemed together, sometimes it's just about serendipity, like it is with most opportunities. So I was in surgical training and I met someone who's an ENT and they're very inspiring and seem to have a happy, fulfilling life. And then as you get to see the range and breadth and depth of what we do in ENT, that was inspiring. From little newborn babies to end-of-life issues, from tiny little operations on ears and voice boxes to big operations involving incisions in the neck. So it very much appealed. But then more specifically for me, for voice, airway, and swallow, I have a music background. And so the ability to marry the two, the surgical specialty and the art, I suppose, of the voice was immediately appealing. And right place, right time, introduced to someone else who was inspiring in that field, and cliche, but the rest is history.
Fantastic. And I'd love to hear a little bit more about your musical background as well. So what does your musical background look like?
Look, at the moment, it's mostly my kids would say torturing them with their cello and violin and piano lessons. But myself, classically trained in piano and viola, so did classical training up to A-Mas, and but also did a lot of singing in a cappella choirs through school and competitions, and also my mother is from Slovenia, tiny little town, tiny little country next to Italy, and they have a strong folk song tradition, as most smaller countries, as most countries do. And so we did a lot of singing, my sister and I, over the years. So it's as most of your listeners know, music from an early age, it's just something that grabs you in your soul, and it always keeps grabbing you. So now I get to share it with my kids in the car and with my patients and clients, I suppose. So it's good to be able to bring the two together.
Yeah, and it must be amazing to be able to bring that passion into something that you are doing for your living as well, and have that sort of background of understanding of what's actually going on, that so many of us wouldn't really have that kind of depth of understanding.
Perhaps, and you're probably too kind, actually. To be honest, every day I realize just how much I don't know, and how out of touch I am. So I get educated and schooled every single day by singers and performers and musicians. So no, at least I have some inkling, but no, I'm still very much a student.
I think we all are to some degree. So I
Yeah.
guess so many people would have a general kind of idea of what an ENT would do in terms of surgery, like a basic kind of understanding. But would you be able to maybe take us through a little bit about what your kind of average working day might look like?
And maybe, I suppose, just for the audience today, I'll talk to you a bit more like the voice, airway, swallowing aspects, or laryngology, as you mentioned. So I suppose as an ENT surgeon, first of all, we generally work in a team. So we usually work closely with voice therapists, which is obviously a subspecialty of speech pathologists. And so we're very much a sort of complementary duo a lot of the time. And patients, I suppose, come to us mostly in terms when they feel their voices is somehow disordered, and by that I mean their speaking voice or their singing voice, and or both, and maybe their airway and their sense of breath, and their swallowing. So an average day might involve all day of consulting. We will see patients and clients. They can be professional musicians and performers, or just an older person who's missing out on talking to her friends over Zoom during lockdown because her voice is giving out. So everything in between. So we'll have consultation with them. We take a history. We examine them using specific equipment, which enables us to see down into their larynx, their source, their sound source, their voice box, their vocal cords, either through the mouth or through the nose. High definition cameras, something called stroboscopy, which is essentially almost like a slow motion video camera image of those vocal cords vibrating at a few hundred times a second. And we give them some diagnoses and plans, and then treatment options. And these treatment options might be anything from simple reassurance. No, you do not have nodes or nodules. You do not have a hemorrhage. You're okay. We give you permission to keep singing, to keep belting, to keep rehearsing, through to voice therapy with one of our voice therapists, through to medical diagnoses, and of course surgery. And that surgery can be done awake or asleep. Some minor procedures, such as putting fillers into vocal cords, we might do awake for a patient. And then obviously other operations are more major and they be under a general anesthetic. So yeah, it's a huge range, but that's the sort of the gist of it.
No, it sounds very varied. And I guess I mean, it sounds like you see so many different people for so many different types of things. But what are some of the most common things that people might come to see you about? Maybe even particularly people that are concerned about their voice.
For sure. So I think interestingly, during reflecting on lockdown, the last 12 months has been very interesting how it's changed the people that come to us. So I think there's a few groups of people. People who are performers in their own right and who have been not performing as much, not rehearsing as much. And so there's a degree of underuse or loss of vocal fitness. And with that, they might come saying, look, I've lost my range, I've lost my stamina, or I get discomfort and pain when I sing through here. Something's got to be wrong. Help me out of this sort of death spiral I'm in. So there's a lot more patients coming with that kind of sort of lack of fitness or fatigue and strain kind of aspect. There's also been a lot of more patients with a cough or a throat clearing, because you can imagine that's a real problem during COVID. So whereas in the past we'd have very few or less of those patients, there's a lot more people with that concern. And then of course there's the more general things. People worried that their hoarse voice signifies something serious, something nefarious, maybe throat cancer, and a few other, I suppose, things that are almost like, we often say that the voice box is a barometer of human emotion. It's really it betrays you a lot of the time, and that's whether you're just an average person talking like we are, or if you're a coloratura soprano. And so we've seen a lot more people with, a feeling of a lump in the throat. Quite literally, a feeling of lump in the throat, where it's merely the strain and stress of life and lost opportunities and whatever else, or even reflux for that matter, manifesting here. So there's a lot more of that, and perhaps a little bit less of polyps, nodules, or nodes, bleeds on the vocal cord that you might see when people are using their voice heavily and to live audiences or to a classroom full of preppies. And so there's less of those what we'd call phonotraumatic or overuse presentations, and more of the slightly nuanced underuse vocal fitness type aspects.
Yeah, I guess a question that's come up through this for me and maybe some of our viewers as well. When should a person be considering coming to see someone like you, or sort of looking and going, or maybe I'm a little bit fatigued, or maybe I should just go to my GP? At what sort of point do you think that someone should be taking it seriously and taking it to the next level, or do you think that they always should be?
No, good question. You know, that's a cliche I bring out a bit. But as far as how the voice box works, it's a question of form over function. It's not a beauty contest, it's a function contest. Firstly, I suppose, just to get out of the way, if you've got a voice change, pain in the throat that doesn't go away after, say, 2 weeks, at most maybe 4, you should at least be checking in with your GP and saying, no, is this tonsillitis? Help me out. Just in that very rare occasion that it's something serious. But remember that that's still the exception, not the rule. Putting that aside, essentially, any time that your voice doesn't do what you need it to do, if that's looking after the kids and reading to them at night, that's a problem for you. If it's not being able to sing your full set, if it's that your range is gone, or your passaggio has a bigger break than it used to, and it's a problem for your quality of life, then you should look into it. Now, you might do that yourself. You might do that through mindfulness, or seeing a vocal coach, or doing a little bit more time on warm up and warm down, or drinking less caffeine, sleeping more. Or you might see a GP, and you might see us. So all of the above is the right answer. It really depends, but it comes down to if it affects you and your well-being as far as your voice is concerned,
Go get it checked.
then attend to it. Get back to happy. Yeah.
Excellent. And I'm also very curious, in a lot of our musical styles and things that are around at the moment, there's a lot of people that are trying different sounds and different ways of using their voices. And I'm wondering if you've come across a lot of effects out of some of these sounds in your work, and if that's had any effect on the vocal cords of some of the patients you've seen.
Yeah, that's a great question. I'm 41, so I consider myself, right smack bang middle-aged man. But I'm not as cool as I think I am anymore. And so I'm always learning about new vocal techniques, and all through our patients. So the other day I learned about curbing, screaming fry, and other aspects of metal performance. I learn a bit about, I learn a bit more every time I see a performer in that genre. And what amazes me, and not amazes me, but what I find fascinating is how one can do what might sound so far traumatic really well and without trauma, because we can achieve these sounds with really good technique. So a lot of the patients I've seen recently, and I say patients lightly, they're just coming for a healthy vocal cord check a lot of the time, who are trap metal, heavy metal, rock, belters, etc., have a really good background in terms of their training and their vocal technique, and they can easily belt out a standard or even an opera solo as they could some curbing or some heavy metal fry, So yeah. I suppose it's not as initially when I got into this, I thought, oh, that just sounds so devastatingly bad for your chords. But and this has been just as an ENT, and I'm just I have only a certain degree of knowledge that's complemented by everyone else in the team. It's not as traumatic as I expected.
Yeah. No, that's very interesting. And
Does that sort of answer that question, Karen?
Yeah, it does, absolutely. And so you mentioned as well the team. Would you be able to maybe give us a little bit of an understanding of who's sort of on the team and who you work with to really give that full team?
Yeah, for sure. Yeah, it's a cliche, right? There's always a team, but it's true. So as I said, the first part of the team, really from where we stand, is at the core is like the speech path and I, or the voice therapist and I. And I'm lucky enough at Voice, where we work, that a lot of those guys are already singers and performers in their own right and have that musical background, but that's the core. Then I suppose the next bigger circle is the people in that patient's team. So if they're a professional musician, they'll have a vocal coach. They may have a manager, and that's a whole different kettle of fish as well. They're a key part of the team, but at some parts they step out of the room, if you know what I mean. And then beyond that, from a medical sphere, there is, say, a neurologist, so nerve doctors. So sometimes people might have a stammer or a tremor or something that we send to a neurologist for. It might be that it's because their sense of breath, they're short of breath and they don't have enough breath because they actually have uncontrolled asthma or a chronic lower respiratory tract problem. So we'll send them to our lung guys. Sometimes it's in uncontrollable reflux that we can't get on top of, or a feeling of discomfort here, so we'll send them to our GI or gastroenterology guys, so the specialists that look after the food tube and the stomach. And of course, there's also performance psychologists, and another key part are performance physios. So we work closely with a few big groups who do a lot of circum head and neck work, I suppose, but also more Alexander technique, breathing, posture, core strength, etc. as well. So they're a key part of the team as well. So it's really refreshing because there's always a problem for some patients that we can then share, and we can navigate a solution, which is great.
No, that sounds absolutely amazing. I guess as well, looking at, I mean, obviously people are coming to see you when they notice that something is wrong. But what are maybe some things that people can do to prevent some of these issues? So I know you've spoken a little bit about vocal technique, but are there perhaps some other things that we can do to take care of our voice to avoid some of these issues cropping up?
For sure. So taking a step back, and I know it sounds really obvious and it's a bit of a platitude, but general good physical health, exercise in terms of core strength and physical fitness and vocal efficiency. If you've got good breath support and you are healthy, that goes a long way in terms of if we're talking about singing and in general. The duality then is also of the body as the mind, especially during this last 12 months. We've found that a lot more, it's more than ever tied to one's mood and mental well-being, and it's tied into getting enough sleep. So as much as it seems so obvious, it's amazing how quickly we forget that, hang on, that has a big impact on this. So those are the more general things that we find we're revisiting more and more. More specifically, things like laryngopharyngeal reflux. It's a little bit overstated perhaps in Google and the media and the world. Everyone knows about Gaviscon and low acid diets and things, but certainly reflecting on your diet and lifestyle in terms of say irritants that might increase reflux. That is, for those of you who don't know, it's basically that sort of retrograde or movement of stomach contents, enzymes and acids up the food tube and up to the voice box, causing things like hoarseness, a feeling of a lump in the throat, mucus and clearing. And so we talk about reducing foods that increase reflux, and unfortunately it's all the good things. It's caffeine, it's alcohol, it's peppermint tea, it's fatty foods, fried foods, spicy foods. Basically anything that Uber Eats delivers is probably reflux inducing. And then in terms of other aspects of health, vocal health, of course, it's the things that a lot of singers know far better than me, which is make sure you make time for your adequate warm-up. Don't forget you warm down. If you're a professional doing a lot of Zoom work, make sure your environment that you're doing your Zoom calls and meetings on is appropriate in terms of sound attenuation, good feedback, good mic, good posture. Don't slouch and Zoom in your bed, with your head on your chin on your chest. All these little 1%ers can make such a big difference. And I suppose reflecting on your own vocal health on a fairly regular basis in some way, even if it's like you have your standard glide or your standard little passage that you like to use as a test, something like that, or even making a lot of the sort of more high-end's the wrong word, but the very serious professional singers we meet can become, almost obsessive about it. They'll have a diary where they'll talk about they'll reflect on their voice day to day and what they did or didn't do, so they can keep track and sort of work out beyond superstition what might be the thing that they need to do to stay healthy.
Yeah.
And maybe it's new to people, but certainly if you ask around, we find everyone has their own little story on that front, you know.
Yeah, no, that's so fascinating. And I think, I guess if we look on the other end of the spectrum as well, are there some things that maybe people are doing that maybe they might not be aware could be damaging their vocals a little bit or causing issues that
Hmm.
maybe they think is absolutely fine?
Yeah, well, that's a great one. So speaking voice, right? We take our speaking voice for granted as just something we're able to do forever and ever, 25 hours a day. And the
Mm,
singing voice is the thing we treat with kid gloves and, pay a particular attention to. So you go to sing, you'll have a good posture, I'm assuming, you'll warm up, you'll warm down, but then you'll go and just sit on the couch and talk for 3 hours or use your voice casually. So we
mm,
find a lot of singers and casual voice users will have poor technique with their speaking voice more
mm,
so than their singing voice. So that might be something that a lot of people don't realize. We see a lot of young up and coming performers, maybe who are doing a lot of press or just doing a lot of interviews and things around their singing, and that really takes its toll. So having a sense of your speaking voice and how you're doing that, not falling into fry, having good breath support, forward resonance, doing all those things that you might do in singing,
mm.
having it in your voice as well when you speak, I think is also quite useful to think about.
Yeah, and I think that's a really important point to bring up because I think a lot of people don't even think about the way that they're using their voice when they're talking. So, yeah, that's great. I also wanted to bring up you've been working on an app for vocal fitness training. Would you like to maybe tell us a little bit about what's inspired you to work on this app and what it's all about?
For sure. I think
Mm,
it's a few fold. In our line of work, we treat a lot of disorder, and that tends to be the focus. But there's a lot of great people using their voice for all kinds of reasons that just want to stay fit and stay
mm,
healthy. And every second person has an Apple Watch, they can track their sleep now, and they can track their
mm,
physical fitness, their steps, and so on. And I just thought, there's no real way I know, easy way that's user friendly that I, as a layperson, say, could track my vocal fitness. And so I started having conversations with singers and other voice doctors and speechies, voice therapists about what that might look like and how we might be able to approach something that is user friendly. And so we've been, honestly, I think I've been working on it for about 4 or 5 years, but like every love project, it gets that spare time somewhere between 12 and 1 a.m. and it's taken a while,
mm,
but we're kind of getting there. So I think that was more, I suppose we're trying to focus on what a performer or singer might want to do to track their vocal fitness, but also get those insights we talked about.
mm.
If there's a way you could track some key parameters in what might represent a healthy voice, objective one,
Yeah.
but also track super important emotional, functional factors as well, and even stuff that you might not think about, like your menstrual cycle, for example, in terms of vocal fluctuations.
Mm,
Um, those insights might be empowering for you as a singer. You might go, aha, you might have one of those little epiphany moments.
mm,
And so we wanted to see if we can work on it. So look, it's still in alpha stages, and
yeah,
as much as this is a plug for it,
yeah.
anybody who downloads it, we'd just be fascinated to hear what they think really, and how we could make it better. But that I suppose that was the inspiration, and yeah.
No, that's great. And so if people want to actually download and be a part of the testing, where can they find the app?
Yeah, for sure. So it's just I'll just make sure that it actually works. But Google Infinivox app, um, and it's just Infinivox. That's I like infinite, INFINIVOX as in voice box or Vox .com. And that should lead it just to a very simple landing page where you can download it. There's no clickbait. There's no endless spam emails. We ask your permission to maybe say hello after a week if you're having a play. More co-conspirators are another doctor who's also an IT guy, and another doctor who's also a soprano opera singer. So we all have a passion and a love, and ideally one day, perhaps if this was able to track, personally for people, their voices, one day maybe it could become a bit of a place where people can share their vocal exercises and their tips and their tricks, and become a bit more of a community. But for now, it's sort of trying to make it a bit of a tracker. So thanks for mentioning it. And if anyone wants to check it out, we'd love to hear your thoughts.
I do have to ask you as well. I am very curious how you manage your time because I know as well that you do have three very young children. You're an ENT, you're consulting, you're building this app, and on top of that, I believe you're quite involved in the medical side of the marketing as well. So you do have so much on your plate, and you've joined us tonight. So how do you manage to fit all of these things into your schedule?
I do all the things I tell my singers not to do. I don't sleep
Uh,
much. I drink too much caffeine. I don't smoke, at least. But yeah. But look, like this, what you're doing, Karen. If you have a passion, somehow it just energizes you. And I know that sounds a bit sort of fluffy, but it just keeps you going. When other parts of life are difficult, your day job, when you're wearing 14 layers of plastic and seeing people and swabbing them and so on in the last 12 months, you go home and you see your kids, or you do this little passion project, and you quickly find some energy. So no different to anyone else who has a passion out there that they're chasing, So
yeah. No, very good. And is there
and I
anything
must
else? Like,
apologize. I realized I started
sorry.
this interview with a lovely sunset, and now it looks like I'm under the doona covers. So I apologize.
All right, we're seeing a full range of weather changes. So, is there anything else that maybe you would like to share with the community, whether it's to do with their vocal health or anything else that you'd like to share with them before we finish up?
Um, the one thing I would say is find your confidence in terms of your voice. And I think you find your confidence through knowing your voice better. And I don't mean become obsessed and worried about it, but certainly if you have a concern, see your vocal coach, find a path back to confidence and healthy voicing. Because we get so tied up in knots and I say we, but a lot of your audience, and I've looked at your website and I see the wonderful contributors there and performers and amazing new talents. We get so tied up in knots in our own internal dialogue. So make sure you share your voice, whatever forum you find, be it Sounds on the Couch or elsewhere. Share your concerns, your fears, and keep using your voice. Even if you're not performing, not gigging, you're not laying down an album, make sure you're still using that, singing every day, or reciting, or slam poetry, or whatever you're doing. Just like any other part, you exercise, you stay healthy, and remain confident.
Yeah. No, that's great. And I guess if people are looking to find you for a consultation or
Of course.
have decided there's something that they need to discuss, where can they look for you or look for somebody like you that might be able to help?
By all means. So in terms of national bodies that really are great for locating someone in their area, I would say the two key ones are the Australian Voice Association, and that's a beautiful multidisciplinary organization that is full of singers, performers, vocal coaches, ear, nose, and throat specialists with voice expertise, and of course speech pathologists. So that's AVA, Australian Voice Association. And number two would be the LSA, which is the Laryngology Society of Australia. A little bit more medically based. If you want to find yourself a voice doc in your town or nearby, that's where you'd go. As for me, I'm with a team. We're based in Melbourne with the Melbourne Voice Analysis Centre, and you can check us out there. If we're online, you can live chat us at all kinds of weird hours. So I'm working on Infinivox or something, and you can shoot us a question. And check us out and come visit us in Melbourne. Get a GP referral if you're really worried. We'd be more than happy to try and work out your concerns down in Melbourne.
Oh, that's so amazing. This has been so insightful, and I thank you so much for taking the time to have a chat with me.
Not at all. It's been my pleasure.
Thank you. And thank